Okay, this is the freestanding urinary apparatus. This. It's the back side, posterior side, anterior side. It's the pubic symphysis. Okay, so you know you're looking at the front. Okay, so this is the abdominal aorta. Right. This is celiac trunk. It's alright. This is covering our vessels too, so I'm hitting everything here. The superior mesenteric artery. It's this. Okay. The right renal. I don't know if any of you know our left to our right, but this is the right renal artery. The left renal artery. This right here is the inferior vena cava. Okay. The right renal vein and the left renal vein. Okay. You don't need to know the right gonadal and the left gonadal testicular vein, but the right adrenal gland. Right adrenal gland. That wasn't our last test, but this would have been right here, the right adrenal gland. Okay. Number 12. Right kidney sagittal section 12. I don't know my stuff. But this is the right right here. It's pointing right there, but that's the right kidney, the sagittal section. But this is the kidney. Alright, the cortex. The cortex is here, the renal cortex in our book, in our lab. Renal cortex. Okay, right renal cortex. Or the renal cortex. The renal medulla is right here. Okay, 14. We don't need to know the adipose coat of the renal sinus, but the renal pelvis is renal pelvis 16. Renal pelvis. Oh, this. The renal pelvis. Renal pelvis. Okay, the renal column. The renal column is here. All of this right here. Renal column, renal column. Renal column, renal column, renal column. Alright. Major calycis or calicus. Whatever. Major calycis right here. Okay. Right here. Major calycis. Minor calycis right here. Branches of the artery would have been right here. Branches of the renal artery and vein. Boom, boom. Okay. Renal papilla. 22 is here. This would be the renal papilla. We don't need to know the hilus or helix, but we need to know the 24 is the ureter. This is the ureter. The broken ureter.
Does that make sense?
Okay, we don't need to know the right gonadal testicular inferior mesenteric artery. Number 27 here for blood or vessels and arteries. 27 inferior mesenteric artery. 28, just in case we may need to know this, the bifurcation of abdominal aorta is this. Okay. The right column, common iliac artery is right here.
Oh, right here?
The left common iliac vein is this, the blue.
Urethral gland.
The left common iliac vein. This is the left side. And the artery. This right here is the femoral artery, left and right. Femoral artery, femoral vein. Femoral artery, femoral vein. Okay. The urinary bladder is this. Okay. There. Urinary bladder. Goes like that. Urinary bladder. The rugae is inside. Is this? The folds. We don't need to know trigon, which is that, just to show you. Well, since it is part of the prostatic urethra, but we're gonna go to the uvula vesica and internal urethral orifice. That would be.
Should be behind them.
That would be right there. The urethral crest would be right there.
I highlighted all of these, so I know it's gotta be in here.
The prostatic utricle. It's not on our lab, but just going down. But anyways, and for
Cremaster?
this would be the prostatic urethra.
Did I give like a whole section? Cremaster.
So it would have been right here. So taking this and flipping it around, because it would be right here. Well, we don't need to know this, but orifices of the prostatic ducts, it would have been right here. But just in case, cover it. Orifices of prostatic duct. This right here is his prostate gland. The detrusor muscle is this right here.
Okay, cremaster muscle.
We don't need to know the serous coat of the bladder, but the ductus deferens or the vas deferens is this. And the seminal vesicles are these. Okay, this covers pretty much the whole urinary bladder and parts of the veins and arteries.